Iqaluit. It is Friday, March 19th. It has been a while since we've been televised. Thanks, everyone. We didn't have access to this space or the TV channel with sessions, so thank you. There's no big announcements today, but we did want to just provide an update, which we're going to try and do about once a week moving forward for the next little while. So Premier has a brief update, Dr. Patterson has an update, and then we'll go right into questions. One question, one follow-up. Thanks.
Laaset hullumi tällainen March 19, että sauna saakka. Hullumi ila tyynä hajungin että kappanit ei maimat kita takut sauna saakku. Hullumi tusarat sa haluangittuugalua qammalu tusarsaarattalangalammii takut saulutti pinasaarusitamaan. Sewlertiu halimalaornilu ta Patterson uqali.
Nunavut mi ublatia ko pahi. Ublumi ubdu tadlimat hawani nutane nuban na yakan nilekto. Yani mana tako nuban na yakak tu mago huli hawai luani. Ublumi mi tikit lugu tako 18,000 nuban na yak tare gutini kaputini atok himayu nunu iluani. Tana Moderna vaccine tana nuban na yak tare utit 11,554 Nunavut miut hibud lakpa mi kapiyaw himayu. 6,413 Tuglia ni kapiyaw himayu. Takwa 6,413 pianik himalatu Nunavut miut Nunavut na yak tare utit mi kapu mi. Takwa ekaiti kana wakta katakwa Nunavut miutan kapiyaw himangin nawin. Anyawi mo kalulutit kapiyaw guang naralutit kapiyaw yakto maputit tan kaput tamapta Nunavut iloni kapukta ukta tan wan na yo tare uti gumutak ta ko Nunavut na yo nung atang naman mahanan naw watchao akagupigal wa hanan naw lagi matak wa va miutat ulay koyali yung atak wa malit sa tamata mat na sugitaw ta ko malin na law matatak wa anna tailiti chiku pekoyang inni tao yung ako naktukwa anit tailisuni ubdaluk tailisuni takwa mat na khimad lak patakwa wa miut ay nalat sa tamata nuban na ya kawon niya patak ngakwe no agata ko maktunga takwa akwe ni nuban na ya hutero tilaw khimagalaman kawi mayunga an upor hulak nga takwa hutero tikkanang naman awa miut Good morning. For the fifth day in a row, there are no new cases of COVID-19. There are still active cases of the virus in Iqaluit. Today, Nunavut has administered almost 18,000 doses of the Moderna vaccine. 11,554 Nunavut have received their first dose. And 6,413 Nunavut are now fully vaccinated against the virus. I'm once again asking that if you have not made an appointment to get your vaccine, please do so. I got my second shot a few weeks ago, and I feel great, and I'm thankful for have gotten the vaccine. Heading into the weekend, I want to say thank you to all Iqaluit who have had to sacrifice so much and be so strong for so long, and I know it has not been easy. Iqaluit got to 0 cases before, and you can do it again. Keep up the hard work, follow the public health measures, stay healthy, and stay safe, and Iqaluit, we will beat this virus. Thank you.
Good morning. Last week was the 1-year mark since Nunavut and the world began dealing with this pandemic. In that time, a lot has happened, and I want to mention a few highlights. Through public health measures, including isolation out of territory, we were able to delay the entry of COVID-19 into the territory. Those first 8 months were invaluable to our planning efforts, which paid off in several areas, including fast and efficient contact tracing and containment, improved testing capacity and turnaround, efficient rapid response and outbreak management, and a vaccine campaign that by April will have given 75% of Nunavummiut who are 18 and older an opportunity to receive their shot. We all knew that preventing COVID-19 from ever entering the territory was not possible, but limiting the number of communities that have had to deal with cases of COVID-19 is a success.
Ulla sagut pinasaako siulaw tumitay maqagu limamik nalunay ko tawlaw ko Nunavummi nunak joami lo kamapalya law at sa mapalyanim. Dahil sumani ami suni kaniligut ako sa simalaktugot ang malu ilangin no ko sa kakain na kumalang langay mapilo ang waktu ni. Dahil matutukat sa ato na anaham nang itulang ng mamalitaw kay luta ilagay yaw lo ni anitelitik si kay nakatang ni Nunavummi utang na ato ni. Kingo varas magun na law tabo Nunavut 19 tikipalya ni Nunavummi. Dahil ko na ni sibula pa may 8 ni dakinig ta ko ato tikat sa law to pang na igutigis si mayabot o kuninga pilo akto mi. Kilamiyo yukut katiyaw si mayo na kaway sa katang na kamalo siyang maktitsitay na. Dahil ko alo kaway sa siyang nakatalag suta malo kilamiyo yukut kaway sa kutiyo ti katalag tutik kilamiyo yukut li kayo kaya ito katak to niya malo siyang makpalya yun ni awlat si katang na. Dahil nalukapi si valya na April katay ko 75% ni Nunavummi 18 ni ukiuli yung atanulo kapiyaw gunak si maniakton. Kaya mayo inawlok to gunuk hangatit sini Nunavut 19 may tikitis sini ang Nunavummi tayo may gumnalang alaw nito kasi ani taman na isulitak hakbit sigutaw lok to nunalin no kamagyato law nito no taman na kayo si Sergio Teo si mayo sa maksimangin ningan.
As of this week, Nunavut received its latest shipment of vaccine allocation in Phase 1 of the federal government's rollout plan. Since December, 37,500 doses of the vaccine, enough for 75% of the adult population, have been delivered. As of this morning, 11,584 Nunavummiut have received their first dose of the vaccine. I must commend the hard work our teams have done rolling the vaccine out across the territory. By April, every community will have had at least their first dose clinic. For those communities that have completed their second dose clinics, there will be an ongoing opportunity for everyone to get vaccinated. Simply call the health center.
Tabani pinasako sa mutikit tugo Nunavummi tikipiw si mayugo kinula pa me tikipiw law to kaputinik sibula pa ni government to hakun ni pangnaw tigi si mayangin ni. December minik 37,500 kaputi tikisimayu tako et na matuti 75% tingin Nunavummi tikisimalekton ula mo tikit tugo 11,584 Nunavummi kapiyaw simalekto sibula pangan ilang iwalong tay ko upigi gumayakat suru takak simaningin piliriyivon tako kapisakatatilogin Nunavummi April monot nunalilimaan tay ma sibula pa me ilang iwalo kapiyaw katak simanalekton tay ko nunali tay ko tudlian ni kapiyaw si mayot suli pivikain nang nakto kikuli ma kapiyaw gumayo pivikak titaw gunakulugit o kala to inalo sa narbit sinno.
Those who want the vaccine after the mass clinics are done will be put on a wait list and called for an appointment. Due to the vaccine being packaged in 10-dose vials that are only good for 6 hours once punctured, appointments will be scheduled for 10 people at a time to avoid waste. Considering there is a global shortage of the vaccine, we have ethical responsibilities to ensure Nunavummiut are vaccinated as quickly as possible while minimizing how much vaccine is wasted. With the vaccine rollout well underway, many have inquired about what the effect will be on public health measures and when we can begin to see restrictions eased.
Tay ko kapiyaw gumayot kingunyago kapi sa katalaw tilugin tay mga tingit utak titirak tayo katanayak to utak ukala biyo katalo tinit sa liyo tayo katakon na kayakton takwa kaputi mga tukok tayo sa mga katang kata huli lutik takwa lo ikakane 6 nik kasi ane piyugun ng kata mataw sa malak tilugit takwa init sa liyo tayo kataknayak to huli lutik ataw chik ko inuin takwa nunak jo amila amigas mata kaputi ning tay may inut siyang unik ko pilirat sa hakat Nunavummi kapiyaw katakulugi kilamiw yukko tay maunga tuina artitsingillu takaputini. Taima kapisaqattarna pigiarsimalertilluga misaapekkutaraqattarsimayo qanu attuineqarnearmanga tatamatumunga anneaqarnangittuleernammu malittaugialinnu ammalu qangakku taakua qasujauvalliagunnarsinearmangata.
This vaccine is very effective and reduces the risk of severe infection and complications from COVID-19. Once all adults in Nunavut have had the opportunity to receive the vaccination, we can once again assess the risk. As in the past, the easing of restrictions will be done gradually to ensure it does not cause a significant risk to health. Choosing to get the vaccines means that individually and in time collectively, we will no longer live with the fear, the harms, and the restrictions brought by the COVID-19 virus.
Tana kaputi atuuti hatsiartoq ammaluluqeanartumiiteilitissimanersaugunnartoq qanimmaguteqallarigunnanermu Nunavut 19 innailimaat Nunavummi kapiyaugunnarsimaleqpata taima qauyisarunnerneartavu qanutigauluqeanarmanga taimaat sainakingunittinni taakua qasujauvalliatillugeisulittarbbiutitaujut pivalliakkutaaneartu atautsikkualuortaungilluti taima uluqeanartumiilertitsiqunata taikua kapiyaugumaneartu taikua atunit naammatsippat iluunata katujit lutakap inuuseqarunniarnearatta kappiaanarnermik ammaluluqeanartumiinnermi taakkua isulittarbiutitauvattu Nunavut 19 mu pidjutigillugu.
Kent Driscoll, APTN National News. Dr. Patterson, at a previous press conference when we were talking about waste of vaccine, you had said 5% would be the amount that you sort of factor in as the amount to say could likely be wasted. How are you guys doing with wastage? Are you tracking how much has been wasted? How close are you to that percentage?
Kent Driscoll, APTN kunni. Luta Patterson uqarsimagavi taakua 5% tinginni maunga tuinnareaharninginnu taakua atoqtausimangittu kaputiin qanutigitamana qanittuussimava.
It's been a while, like maybe a month since I looked into that number, but it was well under 5%, closer to 2 or 3% if I recall correctly.
Tamanna haujianna saataqaluaqa kisiani 5% tungaaniitsimayo 2 balu 3% timitaima maunga tuinnaartoqarsimayo.
And Dr. Patterson, the vaccination goal from the get-go has been 75% of all adult Nunavummiut. After the vaccine has been offered to everyone who wants it in every community, are you confident that we will have that 75% pickup of the vaccine?
Luta Patterson taakua 75% tinginni toqaaragaharneralauqavi innalima Nunavummi kapiyausimagunnarsiqullugit. Taakua nunalilima kapiyauviuqattarsimalertillugi suliursaqi 75% mutikiutivalliamangata.
Well, the 75% figure came about because that's been what the federal government chose to supply us with for that first quarter. The goal is and has been to get as many people vaccinated as possible. And so vaccination will actually continue after the clinics have closed and try and get everybody a chance to get vaccinated.
Tana 75% taima qausiriaulaqisimayaga matokakku qarsimammata taima atunis atuinnautitsigajarnermu taima naammattuni taima taana tikiutigunnarasuartaqaluavu kisiaini qaangiutiguttigu piunersammariugajanga taakka 75% unga taanu nalunangittu tikiutigunnalaartugu.
Jackie McKay, CBC News. Dr. Patterson, you spoke, you mentioned in your statement, everyone's wondering when public health restrictions are going to ease. The government has struggled getting people through the isolation hubs. And you've always talked about protecting people from COVID and also weighing mental health. When do we get to a point where the isolation hubs are no longer necessary, that allowing people to get through is more important?
Jackie McKay, CBC, kunni Luta Patterson uqarsimagavi taakua amissunleissamaqattangata taakua aannaarnangittulernermu malittaugialiit qangakku qasujauvallialaarmangata ammalu atsuornartukkuuqattangata anittailikeennariaharnermi Nunavummu utilaunginninginni sapujjausimaqulluta Nunavut 19 mun Hangakku taakua toktaugunnia yakani teilikai nahattangi Nunavut ilaungin.
Thanks. We don't have a definite answer on that right now, but it's protection from the vaccine maxes out about 2 weeks after the second dose. So we have to wait until 2 weeks after the last clinic to consider easing measures. And we're doing the review and planning on those measures, and that includes not just the isolation hubs, but the other public health measures, and how to do it in a way that's safe and appropriate. And some of that is we're still learning what's happening because of the changes in variants and the information on the vaccine that's coming out almost pretty much every day.
Tana sulikiujuti katsiangittu maannaujo taakua sapumisemana mukapuutikku suurlu kapijaujo harsimalertillugu makku pinasaarusi atokpallaasita innahattangata tulliani kapijaulaurtillugin taakua makku pinasaarusi inaalaunginninginni kingullerpaami kapissikhattalautillugi taemaisamassarsiuruti harpalliaasigunnalle tainalaaratta taakua hasujauvallialaarmangata maannaparnauti harpalliajugu taakua hanu hasujauvallialaarmangata taemaasivullerpauluti attanangittukkut naamanaartukkullu ilanginne suli ullutama ilippallianginnahattaratta tamakkualu asijjipallianinga nuvajjuarnau sangijuruqpallianiqartauninga ammalu tamakkua kapuutiu missaanu ilippallianginnaqatta suli taana kiugunnaloonni taqamaanna.
My next question is for the Premier. Next week, the isolation hubs will be in place for a year. Can you update us on how much money the government has spent on isolation and if all that money has been federal money?
Pinasaarusiulaartumia qaagulemaangulaalenga taakkua tuyormi vianitteiliviutitaukeinnaqattartu hanutigi ullumimu kiinaoyanaatoqsamaleqqissaammalu taakkua iluunati-government-oqakkunniingaarsumavat.
I don't have that figure in front of me. I just know it's in the millions, and we have received money to help us open the feds, but I think we've at least paid for at least half of the cost. That'd be a better question for the finance minister. I don't have the numbers in front of me. Takwa initu hibit kapakalarik mga taman na titakaala na hopihimangita kihani millions and nganit. Matakwa government okakut imakanap pangakalu nang le akilak himaya napakanya ubagut. Patna.
Mathieu Sarvé, Radio Canada. So, oh, it doesn't work. Okay. People under maybe my question is for Dr. Patterson. Yeah, this one English.
Can you speak up a little? Speak up.
Yeah. So people under 18 years old, so people who won't get the vaccine, represent just over 30% of Nunavut's population, so it's known. Territory's population is quite young. So how does herd immunity take place in that context?
Mathieu Sarvé, Radio Canada, kuni taakua kapijaugunnangin mata 18 ni kiuli tungaaniittu taakkualu 30% rillugi Nunavut hanoli teema inu hatigi anna majjuta hatsiarunnarnaa hateema itillugu.
To the best of anyone's knowledge, it's not possible for Nunavut to get to herd immunity without vaccinating children, certainly not in most communities.
Teema haimana paavaatullugi teema igunna jaangittu Nunavummi taakua surusi kapijaussimalautinagit.
However, we do know that by far the highest risk of severe COVID infection is is adults, and so the ability to vaccinate all adults means that we've greatly reduced the harm from COVID-19. So in some journals and articles, they're now talking about achieving herd protection first, which is kind of what we're getting at by this vaccinating all adults, especially older adults and other people who are at high risk, to reduce the harms from COVID-19.
Kisani how yimagalo aktugo takwa khanim malo ateli gurnaner mununa vummi takwa innai khanimagut harner sagunangata taime matakwa amisun pa innai kapiyaw hatta khusimava vutayma novadjoana musa mapalle alertit sirunagin takwa lutitiraktaw hatta simayuni pivalle ayuni takwa ino hatigi sapummiyaw kharunna khullugi innai kapiyaw kharlu teikakwa luluranaqtumi kap minnersai kapiyaw khartillugi tayma akawna arsoriyavu.
And sorry, Matisse, the last important part of that answer is that there is research going on to get a number of vaccines to ensure that they're effective in children. And when that becomes an option, then we will open vaccination up for children across Nunavut.
Sani Matisse na ilanga kiulugu takwa khat kapiyaw hattaktu bidjutigillugi soser naman nakawi sarutawman takwa ulura nang niniraktaw lekhatanuna bummirsurusi tay makapiyaw hattarunnarsilaartu sivunitsattinni.
Hi, Melanie Rachat, Nunatsiaq News. I'm wondering if you're seeing consistent vaccine uptake rates among communities, and if there are many or some outliers that are getting significantly less uptake or significantly more.
I can't hear you.
And
I can't hear you.
Oh. Okay, sorry. Do you want me to restart?
Yes.
Okay, so Melanie Rachat, Nunatsiaq News. So I'm wondering if you're seeing consistent vaccine uptake rates among communities and if there are any outliers, maybe a community getting significantly less uptake rate. And in that case, is the government able to do anything or already doing anything to increase uptake, maybe more outreach, something like that?
Melanie Rachat, Nunatsiaq News, kunni takwa kapiyaw hattaktu nunalin bidjutigillugit ilangit kapiyaw gumahattangitut sa mata ilangin ni nunalin ni tay may hattang mga malo Nunavut gavamakkungi khanuilur na khamisunnersai kapiyaw hattakhullugi.
So yes, there are some communities that have had lower uptake than others. In those communities where that's happened, there's been supplies left in the health center, and the staff are continuing to do local outreach to encourage people to get vaccinated.
Okay. Do you know maybe? Sorry.
Ilangin ni nunalin ni tako hatsinaw na sa hattaktu kapiyaw gyartuktut kisani tako ni nunalin ni tako nga kaputi ni khimat sa hattaktu nunalin ni anna bingin ni tako alo iqanayak tingi tay ma tusaktit tusamatitsi ga hattaktu kapiyaw gumayon ni kapiyaw khujilluti.
Thank you. Do you have an average uptake rate across communities that you're seeing?
Kanu tigi khaw magalap ni tako nunalin ni kapiyaw hattang mangata.
Well, no, not off the top of my head. Right now, we're a little under 50% for all adults across the territory.
Okay.
Gaman na yo 50% tingi tatuani to tamani nunavummi.
And oh, sorry.
Excuse me. Trevor Wright, Nunavut News. With the recent case counts being transferred from Manitoba, should we expect similar things to happen with other provinces?
Trevor Wright, Nunavut News kunni takwa Manitoba mi nuwadjoanak tarsamayo Nunavummi nuttiqtawlaw nga tahatsiuningit asingin nitta avittorsimaviuyu ni hatsiuningin ni tamama nuttiqtawyu khalamanga nirippi.
Possibly, but it's on a case-by-case basis and after discussions back and forth between epidemiologists working in our department and epidemiologists in the other jurisdictions.
Taimei tuinna reali kisena tunirtartawlu titako hemiqquyaw hattangata uqaqatihaqpallea hattartugut tako searma pallea yuleriyipuut ammalu asinginni Nunavummi tako uqaqatigi hattartu tamatamamitsaanu.
Since previous press conferences, a couple of other vaccines got approved in Canada. Should we expect to see variations, or should we just expect to see Moderna here in the territory?
Kinulla paami uqalimala uqatsini taikua kanata miasingin nangiqtaw yuqassimalanga kaputinik tako tikinni usava ubbalu Moderna toami kapiyaw yuqaqattaneaqqa.
Right now, the plan is for Nunavut to use Moderna alone.
Maana pang nasimaya toavu Nunavummi Moderna toami kapisaqtaq neartuta.
Kent Driscoll, APTN National News. Can you hear me? Dr. Patterson, some communities have finished both doses of the Moderna vaccine. Now, based on those percentages, the numbers you know, and based on the percentage you had said about 50% of people eligible people have taken it, once every community has been offered both doses, what's your prediction based on that data for what percentage of people will actually take the vaccine?
Kentusko APT ang kuniluta Patterson o kakauga binunalin tako ilangi tamakini kapayaw simalangatik tako 50% min nakakauga vi tako kapayaw hataktun nunalilima kapayaw simaviuli katatamakini kaputini kanu niriupi kanu 30% nunavumeo kapayaw simalila mangata.
Looking at past vaccination campaigns, like the H1N1 campaign, it's probably going to be a little above 65%, or 60%, I mean, when we finish this. But it's a different vaccine, and that was 10 years ago, so it may be different.
Kiyunitin kapisi yung katasima yusulu H1N1 haniman na makapisi katalaw sima tilu tatakulugit niriyunak to 60% tingin ni piyagil simalirot takapayaw simalilaw ningin kisa nitako hakago huli na simalang atatana lo kaputi adyo ng ituni suliman na kaway manang ito.
My next question is for the Premier, please. Premier Savikataaq, one of the things that came up in the most recent Assembly meetings was the other MLA for Arviat talking about the need for a recovery package for Arviat as the hardest hit community by COVID-19. As the other MLA for Arviat, I was wondering if you could tell me, what are your thoughts on that? Does Arviat need a specific package to help them recover following COVID-19?
Premier Savikataaq Kingulapa mi maligalioti katimalauti lugita na veni maligalioti ukalaw ngata ko ikayutit saning tuniyaw giham nga tuni Nunavut anak 19 billo maligalioti ukataw lutitay ko nga venut isumavita mga ikayutit sa kanang ni pitpigaham ning na veni.
Thank you. My answer is still the same that I gave in the House there, and I know Iqaluit are resilient, they're strong, and they're going to bounce back. We will help them bounce back. If there's any medical services that have lag behind due to COVID, then we'll do our best to get caught up. Most of the retail business in Iqaluit, I believe, have not suffered too greatly because of COVID. As we all know, a lot of extra money and resources have been pumped into Iqaluit, and most of that is targeted for food security. But if any issues like economic development issues, as I said, all departments will be working with Iqaluit and with the Hamlet. The Hamlet has done so much for the Iqaluit, and we'll be working with the Hamlet. If the Hamlet requests any specific help in any of the sectors, then we will look at that. But I believe that Iqaluit will jump up and recover. They can't wait till the restrictions are lifted, and people will be rejoicing there. Kiu lawa ko tabanig loyo mi kiu adjilare ne kiu na para ta kwa wa mi khawi mga ma pingu yu mata ta na nuban na yo tai kane ne pata inu to ka ni utak pala ya na mata ta kwa an ya mo au la ga to king wak himan na pata nuban na yo pinjito luni ta kwa au la hok to au la pala ya mala mata takwa king wahik tut anguti ni luglugit matakwa nang minakak to kawi mayung takwa niwa Iqaluit kina yang mi awwa mi utakina yang mi tuniyo tadaw matakaw makuni NTI kunni kibadlak katijay kunni perogam kunni takwa nakita we ila niwa we nakita we awwa ni ano nakimit niwa kakang how law nalda matagla kehenita ko nang minakaktu Iqaluit ikayok taw kaya kang napat ikayok umate wa ta ko ham kut ikayok taw wang napata ama naw ko ikayok taw wang mga ta katimbakatigiluit ikayok umama yabut. And correction from not a correction, but I got technology is good. We got the information for you, Jackie, about the isolation hubs now.
Excellent.
We spent about 64 million, and the feds have paid the bulk of the 64 million for the isolation hubs. Takwa what chao khala o matak how yimang inarak so matak ko initu hiwi kap kanu angitigi yumkina yung matulaw mangata mana mo tikin lugo 64 million matok hemayo tan 64 million hanyo government kakut tamang milukta pa kili himayang.
Jackie McKay, CBC News. I will just follow up on that with you. Premier, that when you say the bulk of the 64 million, you said it before about 50%, so about 50% of that 64 million?
Ako tana Jackie McKay CBC kunik kapariga kanero mayo sibulakti tako ilu nagalati 64 million akilak taw nakakauga vigi government hakkunun 50% ngunara kauluti nallengo ba.
It's the bulk of the 64 million. I was guessing with 50%, because just to explain a bit, when we first opened the hubs for quite a long period of time, we were paying for 100% of the costs, and then we were able to get some money from the feds. Dan 64 million tamang milukta pa government kaku akilak tata ila kinang makai sisuti uwa akili taksuta dan le 50% dalau chame lau tunga watcha ta ko na how to watcha kaito ha matatana 64 million tamang milukta pa government kaku akili takta ila akili lauta.
My next question is for Dr. Patterson. The federal government promised enough vaccines for 75% of the population. Now that we're at the end of that and we have those doses, are these the only doses we are going to get, or are you expecting more doses from the federal government?
Dr. Patterson, tako government hakko sulineang na up to 75% tingin inamat tunod kahit sinalang matakaputi tan natikiuti simalirak tigo neriupi kaningago pikan nila mga ta.
Yeah, we expect there will be more doses. We just don't know yet how many doses will come at a time and when they will be arriving.
Neriutigo tikibiu kanila nitin ni kaputi ni kisan how yamangitugo kanutigi.
Do we have all the doses for the 75% right now, or are we expecting more shipments?
75% ting itakwa pisimalik kabo balo sulineriu givigay.
Yeah, that last shipment, or the shipment last week of 11,100 doses, that's our full allotment for first quarter of 2021. And that is the 75% target that we've been talking about.
11,000?
11,100.
Tako kinulak pa mi tikiti tawlo to 11,100 tako atang yaptugit 75% tingin no na magyali pam na taw si mayo no 2021 mo.
Sorry, I didn't think I had any more, but I do. Melanie Rashad, Nunatsiaq News. So I was speaking with someone at the Iqaluit Health Center in Ottawa a couple days ago, and she said she was in talks with, I believe, the GN about how Inuit traveling south for a certain amount of time, maybe 3 months, would be able to get their vaccines in the south. Is that confirmed, or is it, what could that look like?
Melanie Rashad, nakikiyatan Inuit piliriving Ottawa mi kakatahang go Nunavut ka ba makungin ni kanutako Inuit kapiyaw katang na mga ta takiniping asuni takiyaham na aktawlo titaman na suliva.
I'm not aware of any discussions on that, and it's very much they'd have to be vaccinated according to the local policies and procedures and using their supplies. So the decision is really involving local public health authorities.
Okay, thank you.
Hold on. Taman na kakatigi gutaw yang akaw yamang itaka kisani tamakwa kapiyaw hattare liasingin ni Nunavut sila tani taikwa taw na nga kapiyaw hattare hakayak tut nammine kaputi mini atorluti kaputi ngin taikwa vitok simani oyuni.